Hi there, my name is Dr. Katrina Cox. I'm a naturopathic doctor and I'm the author of The Opportunity in Cancer. I'd like to come on and talk about the second video about movement and the how of movement. This is really important. So we talked about how important movement is. We got into the statistics about how it has an impact on cancer recovery. And more importantly for me, understanding that body movement is a foundation. It's a foundation, and because we've seen a bazillion studies that show that it helps with mood, it reduces depression and anxiety, reduces pain by massive amounts. It helps with people to get better sleep. The most important thing for cancer survivors, though, is, and a lot of people don't realize this, body movement can drastically recover brain power. And that brain recovery is very important, that chemo brain and that foggy brain. And so understanding that body movement is a part of that brain recovery can be part of your motivation as to why you want to or how to come out with a body movement strategy. The most important things is that you need to discover for yourself what works for you, what doesn't work for you. Start with the things that you absolutely detest. I'm never going to run a marathon. It's not something that I'm going to ever do. I'm not a big fan of running, but I could swim. I could swim till the cows come home. I know that that's my thing. So anything around water, kayaking, stand-up paddleboarding, yoga next to the water, having a swim if I can, right? There are so many ways to create movement that make a huge difference for what your body connects with. The second thing that I counsel people to is find your motivation, your why. Why are you doing this? Is it to create socialness for yourself? Is it to create more oxygenation? What are your goals to be able to actually accomplish something so you have something to work towards? And then the third thing, in order to discover this, what is it that your type of body movement does? Okay. And so that's important because does it work your heart and lungs? Does it work your lean muscle mass? Does it relax your mind? These are all important factors, and you can find little pieces of all of that in different things. For example, going for a hike can work your muscle mass. It can also work your cardiovascular system, especially if you put some hills in there, and you can be relaxing your mind because you're in nature. So that's one activity that hits all three. There are others, for example, like yoga, that definitely hit high on the relaxation. Generally don't have a ton of cardiovascular and lung work, but sometimes there is, depending on the type of yoga, but they also have a lot of lean muscle mass and support and balance. And so there are lots of ways to create this environment that'll allow for you, or create this body movement plan that will allow for you to accomplish the things that you need to accomplish. So most importantly, this reminds me of one of these amazing client interactions that I had. There was this 80-year-old woman. She was a cancer survivor. Everyone knew her as Gran. And part of that was because she was very, very social. Unfortunately, during her cancer treatment, she suffered from a stroke. And the doctors came in and told her she would probably never walk again. She kind of laughed a little bit and chuckled and decided that she wasn't going to stay in bed. This woman never sat still. And what she ended up doing was using her IV post and leaned on it and started walking the floors. And what they understood was that she had to say hi to everybody that was on her floor. She had to say hi to all the nurses. She couldn't ever sit still. And interestingly enough, all of that rehabilitation created an environment for her that she was able to walk out of the hospital with no walker and no cane. And that was something that we didn't think was going to happen because of the situation, both the cancer as well as the stroke. And so this is a perfect example of somebody who was able to find the things that motivated her. She needed to be social. She needed to be moving her body on a regular basis. And although she had a limitation, she was able to find a way to make it happen. And so I'd like you to take away from that these 3 tips. Oh, actually 4. 1, you need to know more about yourself. What do you like? What do you dislike is more important. Number 2, what's your motivation? Is it walking your dog? Is it being social? Is it spending time by yourself? What is your motivation to doing it? 3 is find out what movement works best for your body. Is there a piece, or are there multiple pieces? Can you put together a movement plan that incorporates a lot of the different pieces that we talked about? And number 4, what does it accomplish? What is your body movement accomplish? I'm hoping it accomplishes that you feel better inside of your body. Maybe it's meant to address some of these other things: mood, sleep, anxiety, recovery from your brain. Maybe it's just a personal a growth that you want to accomplish. So these are important parts in order to be able to figure out the how of your body movement plan. I hope you learned some things today in our video, and we can't wait to connect with you at our newest retreat that we're looking at launching this spring. So join the Facebook group and our mailing list to find out more, and I'd love for you to join us there.